Good evening and welcome. This is Ann McGuinn, and I have not only the pleasure, but really the pride in chairing Women for a Healthy Environment. We're so happy that you've joined us tonight, and we want to thank you very much for your support and your generosity. Women for a Healthy Environment was started more than 10 years ago, though this is our official 10th anniversary. And shortly you will see a film that highlights all of the accomplishments that we've had over the last 10 years. But at the encouragement and the support of Teresa Hines and the endowments, we've been able to make a strong and a positive difference in Pittsburgh, in the region, helping with addressing environmental concerns and environmental help. We work with schools, early learning centers, and obviously with the families and the public. We've been doing this job for a long time, and we were spurred on by Teresa, and I think that we've accomplished a lot. Certainly you'll see more about it. I'd also like to just acknowledge a wonderful group of women who, without their help, we would not be able to be the women we are today and the effect we're having on the region. So without much ado, I'd like to introduce you to our film. And obviously we'll be here later for answering any questions and any help that you think you need or help that we can give to your families, to your schools, and the information to keep our environment and this region healthy for the generations to come. So thank you so much. Look forward to meeting with you personally at some point, but tonight virtually. Thank you.
Our goal is to protect those most at risk, those most vulnerable. There are so many obstacles that a child has to face that a healthy environment shouldn't be one of them.
The industrialists never wanted us to know what was in the coal. They didn't want us to know what went into making steel. And we're finding those byproducts have lingered here, and they're part of our lives, and we have got to clean it up.
Through education and advocacy, Women for a Healthy Environment focuses on environmental exposures that impact public health. Women for a Healthy Environment was created by a group of women who were impassioned about these issues that protect health.
In the beginning, I think it was really all about education.
Even at low levels, lead can affect children's cognitive development, and those effects can persist into adulthood.
We're not afraid of science. In fact, we embrace it, and it's at the core of all of our work.
There are more than 80,000 chemicals available on the market. The EPA has only collected sufficient health and safety data for about 200 of them, and only 5 of those chemicals have restricted uses.
The lowest number of cleaning products that we found used in one school district was 4. The highest number was 94. And then the average for most schools we found was about 25.
The impact of the school environment on children's health cannot be overestimated.
Processed foods can be a primary source of exposure to chemicals like phthalates, for example. And so our key message here is really eat fruits and vegetables, eat fresh foods.
And in comparison to the 5.5 particles that we found in tap water, we found over about 325 particles of plastic per liter of bottled water that you're drinking.
We have to think about the cumulative impacts of a child's daily life and the things that they're surrounded with. That might be the air that they breathe when they step outside the door to go to school. It might be the pesticide exposure that they have on the playground when they go outside. But if you think about all of these different things, they all matter and they all add up to a child's daily dose of exposure to environmental harms.
And the tragedy of environmental exposures is they are very often preventable. It is possible to test drinking water and remediate the hazard to reduce the lead exposure. It is possible to avoid pesticides through the use of integrated pest management. It's possible to use less toxic cleaning products. All these things are possible.
No one deserves to have their child or themselves permanently damaged because someone decided to save some money and didn't tell anyone.
Because unfortunately, Pittsburgh is the tale of two cities. There is the place that we know and love that's prospering and flourishing, but there are also folks who are just not receiving those benefits at the same rate and level of the rest of us in the city.
We work to make sure that social justice and environmental justice and racial justice are at the core of our work.
It starts in our communities, whether it's in Homewood or the Hill or in Squirrel Hill or in the South Hills. Being a part member and an active member of your community is really what's key.
We've grown so much in the last 10 years. We've been inside over 200 school buildings. We've certified over 70 childcare centers. We have educated tens of thousands of individuals about environmental harms across the region. And that's just the first step. Now we have to think about our vision for the future and ensuring that it really turns to a policy lens as well.
We have to educate ourselves on these issues, and we also have to educate our residents. We have to educate our parents. We have to educate our child care providers so that we can, once we are armed with this information, advocate for the policy changes and the supports that we need.
Anything is possible if you think big and start small. Don't be afraid of having lofty ideas.
We're going to go statewide, not just regional, but we'll go statewide, and hopefully we will go through the United States and really make a change.
The tens of thousands of individuals that we have supported and informed and educated in the community are now advocates for the organization.
We have a long way to go, but we have certainly awakened everybody in Pittsburgh as to what needs to be done and where we need to go.
Imagine if a mom that we spent time with in a community workshop who had been trained and thought about these healthy home principles and guidelines, took that information and took that knowledge and then ran for her city council and said, I'm going to do this because I can make the community a healthier and safer space. That's the future that Women for a Healthy Environment envisions.
Hi, I hope you enjoyed that. I'd like to, right now, I have the great pleasure of welcoming Mr. Josh Shapiro. As you know, Mr. Shapiro was elected Attorney General in Pennsylvania in 2016. He earned his law degree, which I think is interesting, at Georgetown University, which is a great school. But he did it at night while he was chief of staff in Congress. He served 3 terms in the Pennsylvania State House and twice was elected the county commissioner in Montgomery County. As a matter of fact, he and his wife, Lori, still live there. They were high school sweethearts, and they're raising 4 young children. So I know both Lori and Josh are very, very committed to the environment. In the office, they have really prioritized the environmental health across the entire Commonwealth. And they're ensuring that Pennsylvania will live up to Act 27, which really is to change the environment here so that we all have a cleaner and a healthier life. The act says that the people have a right to clean air, pure water, and the preservation of natural, scenic, historic, and aesthetic values of the environment. Western Pennsylvania has to be one of the most beautiful places in the world. And if we keep it clean and healthy and we take care of our environment, it will be here for generations to come, for our children and our children's children. So I, at the moment, would love to just take a second to thank Mr. Shapiro for being here and how grateful we are for the trust that he has put in us and further protects the health for the residents in this region. So if I may, I would like to thank and welcome Josh Shapiro and also thank him for including us as recipients in the PWSA Settlement Fund. Those funds are being used to make sure that your home and your world is a happy and a healthy place. So now, Josh, thank you.
Well, good evening, everyone. I'm Michelle Nakarati-Chapkis, Executive Director at Women for Healthy Environment, and the Attorney General is going to be with us in just a moment. He's just a bit delayed, so I'm just stepping in here for a moment. And I'll give you a little bit of the housekeeping tips that you would hear for in our regular space, but in the virtual space, it looks a little bit different. So as you're here with us this evening, you may have heard a little bit earlier, but for those who joined us recently, there's a chat feature that you'll be able to use throughout the program. So with that, go to the right side of your computer, and where you see chat, there will be two chat functions that you can utilize this evening. The first one is under event, and that's the one where you can chat amongst yourselves and have any conversation. Hopefully, though, that's just on the side and not during the presentation, so we don't want you to miss anything for certain. The other one, though, is the stage chat, and we'll want you to take a look at that. That's where you'll be asking questions of our presenters tonight. We'll try and get through as many as we can. Know that we do have a timeline here with the program and lots of great content, so we might not be able to get to every question, but certainly we'll try and even get your questions answered after the event and communicate that via email if possible. So with that, I'm going to just click over here and see if the Attorney General's been able to join us yet. We know that he does have a packed schedule, and we are so fortunate that he's able to spend time with us this evening. Okay, well, we're still on hold. So with that, perhaps maybe we can take some questions from the audience. If anybody has anything that you'd like to put into the chat that we can explore. I wanted to let you all know, if you didn't see in the chat, that our organization has two upcoming events that we hope you might be able to join us as well. So our 5th annual Healthy School Summit is coming up, and that'll be held on December the 3rd. And that's an opportunity for everybody to come together and have a conversation about a healthy and green school environment. And we have a great lineup of speakers, folks from the EPA, as well as the Department of Health here, because we know that COVID is at the forefront of many of your minds. And so as a result of that, we'll certainly be addressing COVID in the school space. So this is relevant to parents as well as school personnel, teachers, facility directors, and administrators. So we hope that you might be able to spend some time joining us in that program. And then also we have a program on December the 10th, and that's the Community Health Worker Summit. And as some of you may have seen in the chat, we have a community health worker who works with the organization now, going on a year's anniversary, with Jermaine Good and Patterson, who's focused in the Mon Valley. So we'll be bringing together community health workers across the region to have a training session available to all of those folks. And that's a great opportunity for collaboration and learning, both at the local level and national. I just want to recognize Allison, who is a teacher over at Kiski High School and has been with the Healthy School program, her and her team of students. She's a science teacher there, and she said, shout out to my students who've made it to the event. That's awesome. So wonderful to have all of them here. And so that's a great opportunity to make certain that the next generation is here and learning about these important issues that we'll be talking about this evening. All right, so let's see. I'm going to keep on going here because we're still waiting for the Attorney General, who could possibly be doing an interview on CNN or MSNBC, because that seems to be the place lately with all of the activities that have been happening across our Commonwealth over the last 2 weeks. So I'll just give you a little bit of background about the organization, Women for a Healthy Environment. Please visit our brand new website. It's womenforhealthyenvironment.org.
Thanks.
Nope, he's wrapping up. Hi there. I was just telling folks to visit our website to get lots of information and resources. And I said, you were probably on an interview with somebody across the country, and we recognize that your schedule's a little packed. So thanks for squeezing us in here this evening. It's nice to have you with us.
It's great to be with you. Are you able to hear me okay?
Perfect.
Terrific. Sorry, we had but I'm really glad to get the opportunity to talk with you guys tonight. So I'll get to it because I know you've got a terrific speaker in Bob. So is it okay if I go from here?
Yes.
Work for you?
Sure.
All right, great. Well, look, I want to say thank you to all of you and to Anne for the kind introduction. And I want to thank the entire board for leading such an important conversation here tonight. I know that Rob is going to, give you a terrific treat. We know about his work and his tireless efforts to make our community safe, and I appreciate him very, very much. And I want to thank everyone here for, coming out. We all know how important climate and environmental issues are across, and especially right here in Allegheny County. From your work to making sure that we get the let out of water in Pittsburgh, in part by using, as you mentioned before, the $250,000 in settlement funds that we secured from PWSA over lead exposure, to educating people to make sure that they're keeping their communities safe over the last 10 years. I can tell you that your voices have been essential in protecting our guaranteed right to clean air and pure water. And that is enshrined in our state constitution, of course. Article 1, Section 27 of the Pennsylvania State Constitution. It's there for a reason, because without clean air, without pure water, we don't have healthy communities. And look, I don't think it is controversial to have a healthy community, but it seems like a lot of folks, sort of didn't get the memo in the process. And it is especially when it's not in their community, I think they ignore it, especially when they're coming from out of state, and especially when they can make a lot of money off of it. And I want you to know, as your Attorney General, that that is not acceptable here in Pennsylvania, which is why my office took up referrals from district attorneys and opened up a grand jury investigation into fracking operations across the Commonwealth. The companies involved in the cases that my office brought were well aware of the health impacts that chemical spills could have on hardworking Pennsylvanians and their families. Both companies worked hard to cover up the paper trail that would have made their recklessness obvious to anyone who investigated. And both companies put the lives of Pennsylvanians and the health of our environment at risk without concern or consideration for the consequences. Core responsibility of my office is to hold the powerful accountable to the rule of law in order to protect Pennsylvanians. And we're here to put people before powerful institutions and the well-connected. And so when companies break Pennsylvania's environmental laws, when government agencies don't act on behalf of the citizens that they're sworn to protect, well, they infringe on our rights. They threaten our natural resources and our outdoor heritage. And I believe we must hold these powerful companies criminally responsible when they break the law. But I will tell you that's not quite enough here. We also need to strengthen the very laws that they operate under. Right now, there is a gap between what our Constitution guarantees, clean air and pure water, and the actual air we breathe and the water we drink in too many places across Pennsylvania, especially in low-income minority communities. The simple truth is this: we can't rely on these companies to police themselves. It's government's job to set the ground rules and protect the public. And that's why we put forth 8 common sense recommendations in our grand jury report on the impact of fracking in Pennsylvania. For example, we said requiring fracking companies to publicly disclose all chemicals used in drilling and hydraulic fracking before they're on site, understanding the health response and moving these drilling sites away from homes and schools and hospitals, and giving my office, the Office of Attorney General, criminal jurisdiction over unconventional oil and gas companies, basically empowering us and giving us the authority to more easily go after the bad actors and not allow them to hide. Because this industry, these out-of-state investors backed by billions who buy scientists to repeat what they say, well, they have an army of lobbyists and former officials in their pockets who have amassed so much power that they think and act like they're untouchable. But they forgot one thing: they cannot buy us. And we're going to be there as partners, standing against anyone who wants to take advantage of a Pennsylvanian for profit. I just want to tell you and thank you, because organizations like yours play a meaningful role in changing attitudes and laws. You've been critical allies for 10 years now, but the work is far from done. We always need strong community allies to make your voices heard, to protect the public, to protect our health, protect our safety, and protect our welfare in the places that we call home. So I want to thank you so much for your hard work, and I'm looking forward to celebrating many more anniversaries together and excited for the program that you have here tonight. Thanks so very much.
Hello, good evening. I'm Diane Holder, and I'm the President and CEO of UPMC Health Plan. And I'm just really thrilled to be here tonight to be part of the program, Create Change, Voices for a Healthy Environment. You know, as tonight's presenting sponsor, UPMC and UPMC Health Plan are really pleased to have had a long-standing supportive relationship with Women for a Healthy Environment, an organization that empowers women committed to creating a healthy environment for children and families. And it's really represents a can-do organization that represents really the best of Pittsburgh and the best of some of the most committed women I know. I'm especially pleased to be here and celebrate the 10th anniversary, to thank Ann McGuinn and the board and the great staff for their important work, and to laud your so many accomplishments. You know, UPMC shares Women for a Healthy Environment's commitment to educate and advocate for better community and individual health outcomes. You know, we know that healthy communities are critical if we're going to nurture and maximize human potential, and they're really the requirement to foster growth and economic development in our region. In the context of COVID-19, this terrible pandemic, and the economic crisis that's accompanying it, a commitment to healthy environment has never been more obvious or more important. You know, people in disadvantaged communities with fewer resources are especially hard hit right now. Black and Indigenous Americans are disproportionately suffering from higher death rates and infection rates. Poor families, especially those with young children, are experiencing much higher rates of hunger. And women with fewer supports are disproportionately leaving the workforce as they attempt to manage these competing demands of their work life and their children who need help given the limited availability of schools and childcare. However, we know that it is not only a crisis like COVID that highlights where we have chronic economic and health disparities in our communities. The work of Women for a Healthy Environment has highlighted these concerns for years. I don't need to tell this audience that it's not only the doctors that we see or the medicines we take that determine our health outcomes. It's the food we eat, the water we drink, the air we breathe. It's the lead in our paints. It's the safety of our neighborhoods, how close we live to an industrial plant, and the access to education and employment and healthcare. And our health depends on the choices we make and the choices we're deprived of making. Air quality is a serious problem in Pittsburgh, and our asthma rates are high. And we have a legacy of steel and other manufacturing sites that have impact in this region. And we, like most of the country, have toxic chemicals, including PFAS, to contend with. Now, last year, these chemicals were identified in 23 different sources of drinking water across the state of Pennsylvania, including Neville Island and Coraopolis here in Pittsburgh. And many questions remain about what constitutes safe, especially given exposure is linked to various types of cancer, thyroid disorders, and other conditions. But you know what? The good news tonight is that we're privileged to hear from someone who can shed significant light on toxic chemical environmental problems and offer some insights into the opportunities to change the health trajectory for people today and future generations to come. Robert Bilott is a tenacious environmental lawyer who became DuPont's worst nightmare, according to the New York Times. The story in his book, Exposure, Poisoned Water, Corporate Greed, and One Lawyer's 20-Year Battle Against DuPont, inspired the major motion picture Dark Waters, featuring Academy Award winner Mark Ruffalo as Rob Bilott. Rob was a corporate defense attorney for 8 years until he took on an environmental suit that upended his career and exposed a brazen, decades-long history of chemical pollution. His epic 20-year battle against DuPont consumed his life and exposed the worst case of corporate cover-up and environmental contamination in modern history. Rob will take you on a remarkable legal journey that ultimately revealed chemical contamination of massive, unprecedented scale and scope, impacting virtually every living thing on our planet. To date, Rob, a partner in Taft, Stentius, and Hollister, has helped secure over $1 billion in benefits for his clients exposed to contaminated drinking water. Among his many honors, Rob was selected as one of the best lawyers in America for several years running, and in 2017 received the Right Livelihood Award, commonly known as the Alternative Nobel Prize. Please join me in welcoming Rob Bilott. Thank you.
Well, thank you. Thanks so much for having me here. Thank you to everyone at Women for a Healthy Environment, and congratulations on the 10-year anniversary. Thank you to Attorney General Shapiro for being here and supporting all of this work. And thanks most of all to all of you that are supporting this organization and supporting work of groups like this that are helping spread awareness and understanding of the connections between our environment and our health. You know, particularly at a time like this where all of us are dealing with an unprecedented pandemic. And we are just learning. And in fact, I just saw some research released just this week, you know, suggesting that there could be potentially an environmental contaminant that may somehow impact the effectiveness of the vaccines that are being developed to combat this pandemic. And, you know, what are we referring to? We're referring to these chemicals known as, you heard them referred to already this evening as PFAS, PFAS, per and polyfluoroalkylated substances. And, you know, that's kind of a mouthful. You may have also heard them referred to as forever chemicals. These are an incredible class of completely man-made toxins, things that did not exist on this planet prior to World War II. You know, that have this unusual ability because of their chemical structure of, once they get out of into our environment, staying there virtually forever because they can't break down. They don't degrade under natural conditions. Not only do they get out and stay in our environment, they get into living things and stay in and build up to higher and higher levels, bioaccumulate and persist, not only in animals all over the planet, including polar bears, but in humans. Our babies are being born to this day with these chemicals in their blood, pre-polluted at birth. And this is something that's been going on now here, at least in the United States, for some 60 or 70 years, virtually unnoticed. And it's only now that we're really all starting to talk about this and starting to become aware of the scope and magnitude of what is really unprecedented worldwide environmental contamination with significant potential health impacts. So I want to talk to you tonight and tell you the story of how this happened. You know, how did something like this happen here in the United States during our lifetimes, with really none of us even knowing it was going on? And now we're all scrambling, trying to understand exactly what are the effects, what are the long-term effects of having these chemicals in our bodies, in our blood, in our drinking water, in our soils, in our air, in the products that we've been using, and trying to play catch up. And really what happened here, we're talking about something, unfortunately, where the risks and threats of these chemicals were known for a long time by the companies that were making them and putting them out there and releasing them into the environment. You know, some of the words of Attorney General Shapiro were echoing in my head when we were talking about companies that understood these things and nevertheless went ahead or covered up the risks. Here, that's what happened. We had information that was essentially covered up and withheld from the public for decades. And unfortunately, it took people individuals standing up, speaking out in their local community members coming together and rallying together to get the truth out. And this is such an inspiring case, an example of what can be done when people do that, when people get together in their community, working together to help improve their health. It leads to the entire world benefiting. You know, I started my legal career 30 years ago. It's kind of hard for me to believe, but in 1990, at the Taft Law Firm in Cincinnati. And for the first 8 years or so of my career, I was learning all the different state and federal environmental laws and rules and regulations. And a lot of what I was doing was helping our clients, most of which at the time were large chemical companies or corporate clients, and really trying to help them understand the rules about what is allowed to be emitted out into the environment. You know, Attorney General Shapiro was talking about the right to clean air and clean water. I think a lot of people would be surprised to know, though, that under our laws right now, companies can get permits and rights to put stuff out into the air, into the water, and into landfills. And what I was doing at that time was trying to understand those rules, and I thought I understood them pretty well. About 8 years into this process, that there were lists of anything that was toxic or hazardous or bad chemicals. And there were rules and standards that said, as long as you didn't have more than this amount of this particular material, you're okay to put it out into the air or into the water or into a landfill. And my entire understanding of that whole system changed one day when I got a phone call from a gentleman who started rattling off about cows dying on his property, and I needed to help him. And that's not the kind of thing that I typically was doing. So I was about to hang up the phone when he mentioned he'd gotten the name from my grandmother. So I paused and paid a little closer attention to the story. And what he explained was he was raising animals on property outside of Parkersburg, West Virginia. And I knew that town well. That was my dad was in the Air Force, but we moved around a lot. But that was where my mom and her entire family had grown up. We had spent holidays there, birthdays there. So kind of saw that as my hometown. And what I understood this gentleman to tell me was he had been raising cattle on this property, and right next door was a landfill owned by the DuPont company, one of the world's largest chemical companies and one of the biggest employers in town. And for over several years, he had been watching white foaming water start to come out of this landfill into a creek that ran through his property that his cows were drinking from. And he watched his animals standing in that white foaming water, developing tumors, getting blackened teeth, wasting away despite as much food as he fed to them, having stillborn calves, animals being born with deformities, dropping dead. And it wasn't just the cows, it was the fish, it was the deer. And not only that, he thought he himself and his family might be getting sick from being exposed to whatever was in this white foam. And he had spent quite some time going to the local folks at the plant where he wasn't getting much information. He had gone to the state's EPA. He had gone to the federal EPA. Nobody really wanted to talk to him. And he particularly wasn't getting any help in the local town from any of the lawyers, because there was a concern. This was the biggest employer in town, and most people either worked there, they knew somebody that worked there, and they really didn't want to get involved. So he'd been talking to his neighbor one day who just happened to be on the phone with my grandmother, who was bragging about her grandson being an environmental lawyer in Cincinnati. So he had reached out to me and asked, can't I help him? If I just look at the information he had, I'd see there was a problem. So with this connection with my family, I agreed. I invited him up. He brought all of his videotapes, his photographs. He and his wife came up, and these are the days of VHS tapes. So we put the VHS in, and we started watching, and it was pretty obvious. There was a clear problem here. You could see with the white foaming water, you could see these animals getting sick. You could see, he even had autopsies videos where he would cut into these animals himself to see what was happening. And it was pretty clear that this water was coming out of this landfill marked with DuPont. And this is what I did. I helped companies get landfill permits. I helped them understand this. So I thought we could get to the bottom of this. Certainly we could figure out there's probably something in this water that's being emitted above its permit limits or something too high. We could help them get to the bottom of it. So we agreed to take on that case. That was 1998. Ended up filing a lawsuit against DuPont, the owner of the landfill. And at the beginning, we started going into the files, and I was getting all of the landfill files, and they were happy to give me anything relating to the listed regulated materials in that landfill. We really weren't finding anything. And then suddenly I started to say, look, I want to know everything going into that landfill, whether it's regulated or listed or on the permits or not. Then things changed. We started getting into fights. We had to go to court, get court orders to turn over this information. Started digging through all these documents that started pouring in. Those of you who've seen the film, Dark Waters, all these boxes, Everything was in paper back then. It was before we moved to computers. So yes, I spent hours and hours going through all of these documents. And one day I stumbled across a document that mentioned this chemical called PFOA. Went to all of my lists of regulated hazardous chemicals, didn't find that on the list, couldn't find any information about it. So went to DuPont and said, I want all of the information about this chemical. More fighting back and forth. We finally got court orders. They had to turn over this information. I started going through all of those documents. And what I saw was a really pretty disturbing a story, something that really changed my perspective on the entire legal system. What I saw was this was a completely man-made chemical, had been invented after World War II by the 3M company. And it had this unusual chemistry of 8 carbons attached to fluorine. And my experts had to explain this to me since I wasn't a really good chemist. But this was an incredibly stable chemical bond that made it very difficult to break down, but also made it very useful in manufacturing. And so DuPont had started buying that chemical from 3M as early as 1951 and buying massive quantities that were being shipped down to this plant along the Ohio River, which happened to be the world's largest Teflon manufacturing facility. And this chemical that the DuPont was using, keep in mind, 1951. This is decades before the US EPA even came into existence in 1970. Decades before some of the first laws even came into existence regulating new chemicals coming out onto the market. And when those laws came out in 1976, they really focused on new chemicals from that point forward. A chemical like this that was already out there, and I'm paraphrasing and kind of simplifying, but the law essentially was saying for those chemicals, it was up to the companies making and using those to alert the US EPA if there was information suggesting some sort of risk, substantial risk of harm to human health or the environment from that chemical. That would be sufficient for EPA to then go back and start to look at that chemical. Well, I started digging through all of these documents I was getting from DuPont. And what I saw was there was a heck of a lot of information suggesting there were serious threats to human health and the environment from this chemical. It was well known for many decades. And essentially, DuPont simply wasn't telling the agencies or the public, had made the decision not to report it. So the regulators had no idea this chemical was even existing. So what I'm seeing in these documents is, animal testings starting as early as the 1960s showing all kinds of toxic effects. Evidence from the 1970s showing to the companies that this chemical would get into people and get into their blood and essentially stick in the blood. The body didn't know how to get rid of it. So it would stay in people and build up to higher and higher levels over time. It was persistent and bioaccumulative. And then in the 80s, there were cancer studies that started coming out showing that the chemical caused testicular tumors in the rats. And the DuPont scientists looking at this data even sat down as early as 1988 and declared the chemical a confirmed animal carcinogen, possible human carcinogen in 1988. And then they realized we're using a lot of this at our factory here along the Ohio River. It's going up into the air, into the smokestacks, which float across into Ohio where there's public water well fields. We're putting a lot of it out into the Ohio River because it was unregulated. There were no permit limits. So it was going directly into the Ohio River. And there were thousands of tons of this in liquid sludges being dumped into unlined landfills all over the property. So the company went out and started looking to see, is this getting into the drinking water? And by 1984, they had found that the chemical was in drinking water in West Virginia and on the Ohio side of the river. And the DuPont scientists sat down, even though the 8 public agencies didn't even know this chemical was out there. The DuPont scientists said, well, what would be a safe level of this in drinking water? And in 1988, they came up with no more than 1 part per billion, looking at the toxicity, the cancer studies, the persistence, the bioaccumulative effects. And you have to think about that. That's the equivalent of like 1 drop of water in an entire Olympic swimming pool. And it was also about the same amount that you could even detect in the water at the time. The analytical methods, you couldn't even find much less than that in the water. So essentially, this DuPont scientists, looking at all of this data they had, were saying essentially, if you could find it in the water, it's probably a concern. And then what did they do? They went out and sampled again, and they were finding it in the public water 3 to 6 times above that level. And then there's internal discussions I'm seeing in these documents. Do we tell anybody? And the answer, no, it's not regulated. And so all of this information is being acquired internally. Nobody is being told about this. And then what I see is that DuPont, just trying to figure out a way to get rid of this in the drinking water, digs up all this sludge in the pits over at their plant. They were thinking that's how it's getting into the drinking water. It's seeping through these unlined pits, through the soils, into the groundwater, and going directly into the drinking water wells. So they decided to dig up all that sludge. And they took 7,100 tons of C8 or PFOA soaked sludges. And where'd they take it? That landfill right next to the farmer's property, Mr. Tennant, and dumped it in there. And what does it do when it hits the water? It turns into white foam. And DuPont went out and sampled the water going into that creek in as early as 1990. And what did they find? 1,000 times higher levels in that water than their internal drinking water guideline for people. Didn't tell our client. So needless to say, we were able to settle that case for Mr. Tennant and his family as soon as we pieced all that together. And I explained to the DuPont lawyers what we had figured out. Now, at that point, though, we had a real problem. Mr. Tennant and his family were aware that this had been found not only on his property, but in the drinking water of the entire community. And nobody had been told. His neighbors didn't know this. And I'm looking at this data, realizing there is a massive public health threat here. The community hasn't been told this. They're drinking this in the water, likely for many, many years. Not only has the community not been told, regulators haven't been told. Scientists outside the company don't even know about this. So we made the decision in 2001. I sent a letter to the US EPA and every state agency I could think of saying, here's the information we have about this chemical. It is in drinking water out here. You might want to start looking at this. And very naively, remember that's 2001, 19 years ago, naively thought certainly the agencies would jump in and set drinking water standards. Spoiler alert, it's now 2020. There still is no federal drinking water limit for this chemical. But anyway, so that letter went out in 2001 and the community found out finally that this was in the drinking water. They came to us, asked, hey, help us get this out of our water. We want it out of the water now. And we want to know what's it going to do to us in the long term? If it kills monkeys, if it causes cancer in rats, what's it going to do to us, the people drinking it, our children, the sick, the elderly that are drinking this water every single day? So we brought a class action lawsuit in 2001 against DuPont for everyone whose drinking water is contaminated. And as lawyers, that was sort of a difficult process because think about it. It was not regulated. There were no federal or state standards for this chemical. All we had was DuPont's own guideline that they were exceeding over time. So we brought that lawsuit in 2001. And then the US EPA started going through all this information I was sending. Not only did I send that letter, I kept sending them more and more information about this health threat that we were seeing in the DuPont documents. DuPont actually went into court to try to get a gag order to stop us from revealing this information to the agency because it could jeopardize the business. So nevertheless, the court rejected that and allowed us to continue to send this information to the agencies to alert them to the public health threat. In 2002, the US EPA came in and said, we're going to initiate a priority review. We may ban this chemical. You heard this evening in the film, there was somebody who made a reference to the fact that only 5 chemicals, had actually been banned in the US. EPA, looking at what we had sent them, was concerned enough to say, this may be another one that we're going to take steps to ban. In 2004, they actually sued DuPont, saying, you withheld information from us about the threat to human health and the environment. If you'd given us that information years earlier, we might have been able to go out and actually start regulating this. Now we're having to play catch up and try to figure out not only how's this chemical getting out there, but how is it getting into the blood of everyone in this country? Because what we had found out by that point, not only was this chemical getting in the water the cows were drinking, getting into the community's drinking water in Parkersburg, there were internal studies showing that the companies understood this had been found in the blood of people across the United States, going back to 1976. And nobody had been told this. So when EPA sees this information, they're very concerned. They bring this lawsuit. And shortly after that, we settled our case in West Virginia for the community. Immediately got clean water filtration systems put in. DuPont had to pay for those. And one of the other things we did is we wanted to figure out and confirm independently what this chemical would do to people drinking it in the long term. Despite everything we were seeing in the documents from DuPont's own studies, DuPont was denying that there were any threats. Even though all the animal studies they were doing to predict human effects were showing all these concerns, including cancer, the argument was, well, those are animals, those aren't humans. Then when we referred to their own worker studies of humans showing adverse effects, the argument was, well, but they're higher exposed. You have no evidence showing that this is causing harm to people who are drinking it at these levels. So we wanted independent scientists to confirm what we were seeing. We wanted the community to trust that this was the science showing exactly what this did. They didn't necessarily want to rely on what DuPont was saying. They didn't want to rely on a bunch of stuff from court, from lawyers. Wanted independent scientists. So we set up a panel in 2004 to study this, to look at all of the data, everything that was published or not published, and do new studies to figure out and confirm exactly what this would do. We had 69,000 people in that community who agreed to participate, came forward, gave their blood, gave access to medical records. It was unprecedented. The amount of, we estimated 70,000 people in that community were impacted. We had 69,000 come forward and agree to participate in this project. When you think about that, data from 69,000 people was then turned over to these independent scientists. They spent 7 years studying those community members, doing the most comprehensive, most impressive human health studies probably ever done on any chemical. 12 different epidemiological studies, massive modeling of what everybody would have been exposed to over time at their home, in their blood. Really unprecedented level of independent scientific work. And at the end of that process, in 2012, they were able to come out and confirm that the chemical was linked to 6 different diseases: kidney cancer, testicular cancer. And by the way, this is the same testicular cancer as what we saw in the animal studies, the internal studies from the 1980s. So anyway, kidney cancer, testicular cancer, ulcerative colitis, thyroid disease, preeclampsia, and high cholesterol. So you may wonder, well, wait a minute, what was going on during those 7 years? Those of you who've seen the film or have seen the documentary, The Devil We Know, you may have remembered there was a video clip from a 2020 show that came out in 2003. So, when EPA started going after DuPont and all of this was starting to come up, this information started to slightly trickle out to the general public in 2003. That 2020 show was an example. Well, after we settled our case, DuPont settled the lawsuit with the US EPA, paid them a penalty. And then they announced they aren't going to make any more PFOA over the next 10 years. And keep in mind, this forever chemical. It's great that they wouldn't make any more of it, but everything that had been emitted the prior 70 years, still going to be out there until somebody addressed it. Yet when that announcement was made, the EPA kind of backed off at that point. This is 2006, and essentially did nothing for the next 10 years. And then we discovered in documents later, this was part of a negotiated deal with the agency, that if the company agreed to make this phase out over 10 years, that essentially this was going to go away for 10 years. And that's unfortunately what happened. And so meanwhile, the scientists are continuing this study. The data finally comes out in 2012 with these links, and that triggered a couple of important things. Everybody in that class out in West Virginia, they were entitled at that point to free medical testing paid for by DuPont, up to $235 million, monitoring for those 6 diseases. We had thousands of people participate in that plan. And everybody who actually had one of the diseases then had the right under our settlement to go forward against DuPont for damages, for injuries that were actually caused by having one of those diseases. And another thing critically finally happened. Remember, I had sent the letter to US EPA in 2001 asking for the agency to come in and do something about the drinking water. Well, throughout this whole process, we were told, well, we're waiting for more data. We're waiting for more data. While the science panel was working, we were told, well, let's wait for the science panel. So in 2012, when the science panel was finally done, US EPA for the first time put PFOA on a list that public water supplies all across the country had to finally, for the first time, start sampling for. Even though it was still not regulated, they had to sample and tell EPA whether that chemical was in the water. Because one of the first things EPA has to do before they can actually set a federal nationwide standard is conclude that it is, in fact, a nationwide problem, not something just in West Virginia or Ohio. So they wanted data to see whether or not the chemical was being found elsewhere in the country. And I was watching that data go in. And sure enough, the data goes in 2013, 2014. It's being found all over the country. Yet the public isn't told because this is not regulated. So the data is going to EPA. And then in 2015, critical event, the very first case for one of these people with cancer in our community goes to trial. After 6 weeks of a trial, DuPont, the jury finds DuPont is liable for having caused a woman's kidney cancer. So this is, a jury finding that this company is responsible for this environmental contaminant having caused her cancer. Pretty, not a very common event in the legal world. But there really wasn't much publicity about that. People really weren't talking about it. And in fact, there were still statements being made that there were no scientific links to any of this. And despite what this panel said, well, that was just lawyers, and there's really no evidence that this causes any kind of harm. In 2016, the New York Times Magazine finally published an article summarizing all of this history that I just talked about, and also pointing out that the chemical was being found all over the country in different public water supplies. For the first time, people across the country started realizing this chemical was in the water, not just in West Virginia and Ohio, but in other places as well. They called their legislators, their state senators, their water providers. All of those people started finally calling US EPA, saying what I had said in 2001, what's the safe level in drinking water? 4 months later, US EPA came out with its very first long-term drinking water guideline for the chemical in drinking water, no more than 70 parts per trillion. That spurred testing all over the country, and people starting to finally realize this chemical is in the water. And people were talking about it as an emerging contaminant, as if it was something new, when in reality, all that was happening was the public's awareness was emerging, finally. And it was because of this newspaper magazine article, people finally realizing the connection, that this is something that actually impacted them. And what I realized then is we needed to find really a way to, how do we get this story out to more people? How do we make sure that people understand this is something impacting all of us? And how do we get people to pay attention to this? Highly technical, there's all kinds of chemical jargon and legal words. And then we were approached by a documentary film team who came out in 2018 with a fantastic film called The Devil We Know. And suddenly people started realizing, wait a minute, I understand the story, I understand what's happening here, and started asking questions about it. And we started seeing questions being asked at state legislatures. States started moving forward saying, we need to act on this. Federal legislators started saying, maybe this is something we ought to look to as well. Then I got a call from Mark Ruffalo, who had seen the New York Times Magazine article and said, how could something like this be happening in the United States? Contamination all over the country. And we're not talking about this. And it's in the New York Times Magazine, not on the New York Times front page. How do we get this story out to the public? How do we present this in a way that people will understand the significance of and the scope of this problem, and actually get people to start talking about it and do something about it? Because at this point, it had been 18 years and the federal agencies still really hadn't done anything. There really wasn't much awareness of what was happening. So we were fortunate enough that he teamed up with a fantastic group of Participant Media who put together the film Dark Waters. And I hope some of you have had a chance to see that film, because they did a fantastic job in taking this story, but most importantly, conveying what it took for the people in that community and how important it was for individuals standing up, speaking out, and demanding that change happen, despite the most enormous odds, going against some of the biggest companies, going against legal systems and regulatory systems that are long entrenched, but actually prevailing. And what it meant to have a community who initially was very reluctant and opposed to this whole concept, as you see in the film if you've seen it, coming together, 69,000 of them, coming together, working together, providing data that ended up essentially changing the world, giving this information to the scientists, to the regulators, to everybody to start realizing how bad this stuff was and what really needed to happen in order to protect all of us. And as I watched the documentary come out and the film come out, nevertheless, I still saw folks standing up in front of even the US Congress saying there's never been any studies done showing any harm to human health. There's not enough information known to do anything. We should wait to take any regulatory action. We need to study it more. So I really wanted to put the information together, the story I'm talking to you about, somewhere where somebody could go and find, here's what really happened. Here's what this community went through for 20 years in West Virginia to bring this story out about this one chemical. So I put together the book Exposure to try to show everything that it took and everything that happened to get to where we were, to have this one chemical be revealed. And really what we see here in this film, remember, this was all about one chemical, PFOA. And as this information finally started to come out, as the film and the documentary and the book are out and people finally started talking about this, we saw discussions for the first time, policy changes at not only in states, but at the federal level for the very first time, legislation being proposed. And internationally, at the EU, we went to the EU and people were talking about how do we address this on an international basis. And you know, it was fascinating to see what change can come from effectively telling the story and showing people how these communities are like their community and how individuals and communities working together can really affect unbelievable change. But as we saw that story finally coming out about PFOA and steps were finally being taken to ban that chemical and to move away from it, what was happening is, remember how there had been an announcement in 2006 to phase out PFOA? Well, the companies had switched to slightly different chemicals. Instead of 8 carbons, maybe 6, maybe 4, but they still shared this very similar chemical bond. They're still part of the same chemical family. Those chemicals start being rolled out and start being put into products. And sure enough, the new chemical that DuPont starts making to replace PFOA, it turns up in the drinking water in Wilmington, North Carolina. And so people start to realize there's a big whole group of these chemicals now that are being found in our water, in our soil, in our blood. It's not just one, and it's not just in one community. It's hundreds, if not thousands of these. We need to address all of this in a much more comprehensive way. And yet I even filed a new lawsuit in 2018 to try to get independent science, like what we did with PFOA in one community, do that on a nationwide scale for this bigger group of chemicals and have the companies that did this pay for that. In other words, they shouldn't be able to sit back and say, you can't prove that these chemicals are causing you harm. And you, the person who's exposed, you who are drinking this, and you who are letting your children drink this, we get to sit back and wait and see if you get cancer. We get to wait and see if you can prove that this has caused your cancer before anything needs to be done. So I saw that and wanted to make sure that we get the science done. If there is a need for more science, to have it done, but have the companies have to pay for that. And what we're seeing happen in the last year or so is much broader awareness that the communities who are being impacted by this all need to work together and make sure that they talk about this, share their stories, share their common understanding of what's going on in their communities, and realize that everybody has got a similar problem here. And to learn from what we saw happen in West Virginia, hopefully learn from that story so that every community that's now finding out that this or related chemicals in their water doesn't have to repeat that same story, doesn't have to go through this for 20 more years. And hopefully, by sharing this story and finding an effective way to communicate that to people, we can make sure that this doesn't continue to happen. And maybe we can come up even with a better way to fix things going forward and make sure that we are protecting the health of everyone in our communities. And I apologize for going on a little too long, but I really appreciate everything that this organization is doing to help spread awareness of these kinds of issues and the connections between our environment and our health, and the importance of all of us getting together like this and talking about this, sharing these stories, demanding that people take action. We can't sit back and just assume somebody else is going to take care of this for us. Each of us needs to stand up, speak out, like Wilbur Tennant or Joe Kiger in that film, and actually say, I want to do something to make something better, to make things happen. And we can do it. And I'm hoping that people who have seen the film or read this story or watch the documentary are inspired to know it can be done. So thank you. Thanks to all of you for spending the time tonight to talk about these issues. I really appreciate everyone's support and everyone who's taking an interest in this. Thank you.
Well, thank you very much. My goodness. Somebody said in the comments, we need hundreds of Rob Bilotts across the country, and no doubt we do. So thank you for your work to protect communities, Rob. It's such an inspiring story. And, when I watched the movie, it was a little too close to home. Not that we have community members who have the impact, but just in terms of the policy and the advocacy part of it that our organization does throughout the year. And I can tell you, on day one that we were formed, we started working on TSCA reform with other communities and organizations across the country. And so now we have the Safe Chemicals Act, and it's a little bit better, but we still have such a long way to go. And so thank you for your 2018 work. I hadn't known of that, so it's nice to get an update on some recent things that you're doing as well to protecting folks all across the country and beyond. I don't know if you're familiar, but we actually did have PFAS contamination in we have lots of 130 municipalities here and over 30 drinking water systems, and one of those did have PFAS in their drinking water and had to go through the process of resolving that, remediating it through filters. And now they're in the process of suing 3M as a result. So do you have just a couple minutes for a few questions with us?
Sure, absolutely. And in fact, one of the things I'm working on right now is we're working with states and with water providers all over the country on just those issues, trying to make sure that the companies responsible are paying for those costs, not the taxpayers and not the customers of those water supplies.
That's amazing, and rightly so. That's where the funds need to be sought after. One of the things that is coming as a recurring theme here in the questions is related to, we often hear about replacement chemicals. So we have BPA is bad, the science shows us now it impacts health, endocrine disruption, and so then BPS came along, and then scientists had to study BPS and know that that replacement chemical acts very similarly to BPA. And so the question here that's coming up is related to PFAS and having, and folks want to know, are there other types of replacement chemicals like Gen X and others that have been creeping out now that you had described, is it a 4-carbon or 6-carbon? Are you finding that that's happening now as a workaround in terms of chemical companies looking for other replacements now that we have to be just as cautious of?
Absolutely. And in fact, that's the thing that I think most scientists and regulators are really focusing on at present is this concern about the replacements. Not only do we have the chemicals from DuPont and 3M, they're replacing the C8s, but we're just now learning that there are other chemicals out there that other companies are using. In fact, there was an article about a company in New Jersey where the state just discovered there was an entirely new group of chemicals out there that were being found in the water that were apparently replacements for some of these. But there was no information being made available. It was all being claimed confidential business information. And that's an ongoing struggle. As we move from one, it's the whack-a-mole game. You start to finally get enough data and all the evidence anybody could ever need to take action on one of them. You just tweak it a little, call it something new, and then the process starts over again. So there's been a lot of effort and a lot of folks that are advocating to address this as a class, like dioxins or PCBs, where we'd have PFAS. And there are hundreds of them that are already out there in use. And it will be impossible for the agencies to be able to go through the kind of process that we're going through on PFOA for every one of these and to be able to keep up with the changes that are happening. Meanwhile, they keep showing up in our water and in our blood.
Thank you for that response. One of the things that we've seen at the state level, there's certainly a task force with all of the the secretaries of the agencies here working in Pennsylvania to take action on PFAS. So there is a work team that's in place here, and hopefully we'll be mobilizing towards some type of regulation in terms of a threshold and what is a safe level. And I think that's always the question, right? If we see that certainly with things like lead in drinking water, for instance, that things have to be done with the public health in mind, and a public health standard as opposed to an industry standard. So another question, a lot of folks have questions about the community. You were so close to the community, and the movie portrayed that you all just had beautiful relationships that came about then as a result of spending decade together plus. So do you have any sense of what the update is in the health of those 69,000 people now? Here we are so many years later.
Yeah, fortunately, we were able to get a medical monitoring program it put into place. That started in 2013. So we knew at that point that there were about 3,500 people that already had one of these 6 diseases in that community. Or those are 3,500 people who are willing to come forward and actually take them to court. There were probably a lot more individuals who had one of the diseases, because our class, the community, included all of the DuPont workers and their families. And there were a lot of those individuals who, even if they had one of those diseases, didn't want to go forward against the company. But we were able to eventually settle those in 2017. And unfortunately, there continue to be dozens of people who have been diagnosed with cancer since then that are now having to pursue claims. So unfortunately, you're talking about contamination and exposure that occurred over decades. And so unfortunately, these diseases, some of them are, latent. They'll come up years and years later. And so, unfortunately, that potential is still there. And the concern that a lot of people are raising right now is the company switched away from PFOA to this new thing called Gen X. And that is being emitted into the air out of that same plant into the Ohio River. It's being found in drinking water supplies down the Ohio River as far as Louisville already. And what are we hearing? Well, that's new. We don't have any evidence of that, and so there are no safety regulations. So people are now concerned. We've gone from one to now we've got this other thing that's going out there. And how do you keep up with that?
Right. So you just referenced DuPont, and people are asking some questions about DuPont in terms of how have they reacted to your insights into this work and your investigation? And thinking about DuPont, did you get any feedback from any of them, the employees who are impacted on the ground, who are working in these facilities? But can you give us a little bit of sense of the DuPont's reaction, whether it was from the corporate side or from the employees who are suffering just as much as anyone else in that community?
Well, it's difficult when you're talking about a company that has thousands and thousands of employees and has people in different locations and different subdivisions. There are the folks at corporate office in Wilmington, then there are the folks at the local plant. And in our litigation, for example, we found that there were scientists within DuPont that were saying we need to do something about this. There were lawyers inside the company that were trying to get the company to do things differently. And in my book, I try to give the stories, for example, of several of the plant workers, people that actually worked at the Teflon plant in West Virginia, and what it was like for them. Somebody like Ken Walmsley, who worked in the lab since the 1960s, who ended up developing ulcerative colitis and cancer, or somebody like Sue Bailey, who worked on the Teflon line, whose child, who you see in the film, Bucky Bailey, who was gracious enough to appear not only in the documentary and have his whole life story shown, but he also was gracious enough to be in the film Dark Waters. But to show what that was like for these people who, trusted the company, whose entire livelihood depended on them, and what it was like for them to then learn about what was really going on.
Thank you. I appreciate that insight. And I think we'll ask one more question, and then we'll, even though we could probably sit here for another 3 hours, so thank you for being gracious with your time.
Sure.
One of the questions is, it's around, we have some other industrial sources here in our that people are impacted by, and that can be point source pollution, where there's hazardous air pollutants coming out into being emitted into the community that have carcinogens and also asthma, impacting families with asthma. And that, in terms of the industrial sources, we have those, but we have plenty more planned. So, for instance, one of the questions is that we've got a large petrochemical plant that's being constructed now, a little northwest of the city, and it's hard to capture the attention of the public. And so one of the questions that somebody said is that any suggestions on how to get buy-in for action from the community, because that's one of the inspiring things that we're hearing from your story, is that this is an opportunity for the folks who are joining us this evening to join organizations such as ours to really advocate and really move that policy needle and have those voices that are so necessary, both at the local, state, and federal level. And so how do you have any thoughts in that in terms of how we get community engaged and have them be a part of the conversation?
Well, I hope that by sharing stories like this for people to see how important that community action is. I mean, if you look at this story here, really, it was incredibly difficult to get anyone to pay attention to this for years and years. And really, even in the community, there were community members who were sort of pushing back against this because it was a major employer in town. But the critical turning event was when folks finally came together and said, we're going to help for this independent program, to help prove what this chemical does to folks. And I think when people saw how many of their neighbors, came together and were standing there in line with them, and that this became sort of a bonding community experience. And there were folks that were hoping that this was going to confirm that there were no problems. People that worked at the plant, you see this in the film. There was a woman who said, well, you're going to find that, there's no problem here. There were plenty of people who had shared that attitude. But I'm hoping, and I think one of the things those that were involved in the film and in the documentary were really trying to achieve is to show people how important that is for people to not think that, well, somebody else can do this, or there's somebody, it doesn't matter, we're just little people here in this little town. No, that's incredibly important, and getting those voices out there. So I'm just hoping that sharing a film like this, sharing these stories, that will inspire people, to see that there is real value in the community level work.
Absolutely. That's a perfect way to end this evening, with those thoughts. Certainly, I think that it's an opportunity for people to continue to follow this story. We've been talking about your Parkersburg, West Virginia story for many, many years in our community programming as an example, and certainly having it come to theater was really a delight for all of us. So for folks who haven't seen the movie, I believe that they can access it through their DirecTV and purchase it that way, and also on Amazon. And then the book as well. Any other suggestions for how people can access both the book and the movie if they'd like to watch or read following our program tonight.
Sure. Yeah, the book is available on Amazon and online through Simon & Schuster, and the film Dark Waters. Believe it or not, they're still trying to get it rolled out overseas, because this came out right about the time the pandemic started hitting and theaters started shutting down. But here in the U.S., you can find it online through most streaming services like Amazon Prime, and the documentary Devil We Know is on Netflix.
Okay, great. Well, we'll make sure that we can do a follow-up and have people get those links in case they haven't been able to view it beforehand. You've been so generous with your time this evening, and we really appreciate the insights and the behind-the-scenes, so to speak, story in terms of what we were able to see unfold in the theater. In our computer or TV, I should say, in this new virtual world that we're in. I would be remiss if I didn't acknowledge the wonderful sponsors that participated this evening. So I want to just do a shout out to all of them, because without them, we wouldn't have been able to pull this all together and bring you to the Southwestern PA community and beyond. So I'll just wanted to take a moment to thank UPMC and UPMC Health Plan as our presenting sponsor this evening, celebrating our 10-year anniversary, as well as Giant Eagle and Anne McGuinn at the gold level, Dotty Beckwith and the Mid-Atlantic Center for Children's Health and the Environment out of Villanova University, Bill Few Associates, Mascaro, Huntington Bank, the Jewish Healthcare Foundation, Pennoni, Fireman, Meyer, Unkovic and Scott, Coghill Strategies, Sebastian Consulting, and Morgan Lewis. You have all been so very generous with your support. And thanks to all of you who came out this evening to spend time with us in this virtual world. It's something I think we're all getting a little bit more comfortable with these days. I know that there is such a thing as Zoom fatigue, but having nights like tonight really are inspiring and have us very happy to be around a computer and sharing time with others. So thank you to everyone for joining. Thanks, Rob. You've been such a delight, and it's really been a great story for us to share with the Western PA community, knowing that their voice and their action can make a difference.
Thank you so much. It's been a pleasure.
Absolutely. So with that, we'll end this evening and wish everyone well. Have a wonderful evening and a safe evening and a safe Thanksgiving. Take care, everyone. Thank you.